After a knee replacement, what should a patient look for to be cleared to drive? How does a patient get cleared to drive?
So the question was about when is it safe to drive after a knee replacement, and I'll apply the same thing to a hip replacement. And this is a very, very common question for me to get because I live in Southern California. But this is handled differently, for many different doctors. And so if you are thinking about the answer to this question for yourself, I would encourage you to discuss it with your doctor. The advice I give to my patients is that I cannot tell you a length of time at which it becomes safe to drive, because there is no proven length of time. I think part of the reason why is that patients are very, very different and surgeries are different. So, if I operate on somebody who's younger, very in shape physically, and has their left hip done, and they're driving an automatic transmission car where they're probably not using their left leg much, that's very different from, a patient who may be a little less physically fit and recovering from their right knee replacement, where obviously they're using that joint quite a bit to drive. So I don't believe in a time frame. I usually use two criteria. I tell patients, first and foremost, you cannot, if you are taking or have been taking in your recovery any narcotic pain medication, you cannot operate a vehicle under the influence of narcotics. And second of all, the second criteria is you have to be ready to react and slam on the brakes with your recovery. So usually that's a decision that's made, sort of largely based on how the patient feels, but also in conjunction with discussing with the physician as well as physical therapist.